All right, let's go ahead and get started because we have a lot of stuff on today's agenda. As we get started, we're going to go around and do introductions because we have some new folks here. So I'll go this way. Jesse, you want to start?
Sure. Jesse Wilson, County DA. Dan Foss was Med City P, but today I'm proposing something.
We're still done. Dan Foss.
Still Dan Foss.
Brandon Brown, analyst with probation.
Following probation.
Sinclair probation.
Ash Flippo and Aaron, Chief Fiscal Officer in his office.
Sam Brown, Chair.
Shannon Lynch. Rob Tucker, Board of Supervisors.
Jeremy Vance, probation.
Michelle Donovan, analyst in the DA's office.
Aaron Mettler, County Executive Office.
Angie Coffey, Fiscal Officer for Probation.
Jeff Goldman, Chief Probation Officer, and then we'll go up to the screen, and I still haven't figured out a good way to do this, so you guys can just shout out your names.
DP Bell, Behavioral Health Department.
Ariel Lovett, HHSA.
And
Carrie
Jackie?
Klein, Public Defender.
Jackie Britton, analyst for the DA.
We have Jody from Truckee.
Jody Tucker, probation.
Tanya from the courts.
Hi, sorry I'm late.
No problem. And Cinnamon, I think, from Women Worth. Is that correct? Some sort of AI bot. All right, so we have a quorum. We have 4 in person. And all right. Approval of CCP minutes. And so the folks that were here last time were Tanya. No, not Tanya. It was Alex, myself, Ryan, and Jesse. So can I get a motion to approve the minutes from October 24th, 2024? Can I get a second? All right, well, I'll second it then. All those in favor say aye. Aye. Any opposed? Any abstain? Hearing none, motion passes. All right. Any public comment? And I don't know if we have any outside public. Maybe if you want to do it now or
Yeah, that's what I'm.
Okay, I saw that.
You tell me when.
we can do it during the budget part of it. All right, hearing none. All right, bylaws. So bylaws, we've gone back and forth with the bylaws. We went, county council was here last time and took them back. And so she did respond recently. And so with the bylaws, let's see if I have them here. I don't know if we've really answered this question because county council referred me to Sac County's bylaws and said with their, look at their roster. And so on their roster that I printed out this morning, it has designees for just about every single position. And then she said, make sure before you do it, refer to their bylaws, the text of the bylaws. And so when you go to the text of the bylaws, it says the same thing that we were debating, which I think started this whole discussion in the first place, that designees for the executive committee, designees to the CCP executive committee are not permitted except for designees of constitutional officers, so elected officials, sheriff, district attorney, superintendent of schools, and those members statutorily identified in Penal Code Section 1230.1, Parens B, which allow for designees, which are the same as the constitutional officers. So I tried to get a hold of her. She's in court today, so she couldn't make it. But to me, that kind of goes back to like, yes, in the roster, it does have designees. So I don't know if we want to just move forward and say that you can have designees for non-voting purposes, but not for voting purposes, or if we want them to continue to try to drill down on that. Because that was kind of the discussion, is that if the legislature wanted designees, then they probably wouldn't have specified that designees are only available in these spots. So. Any discussion on that? I know, Alex, you had some questions about that.
Can you say that last part again, Jeff?
And we have two attorneys
The
here.
intention of the legislature, can you say that again?
So, and I think Carrie and Alex brought this up last time, is that in the statute, it mentions the same thing that it mentions in the bylaws from Sac County about designees being these certain people. And so county council has said they believe that we can have more designees, but they referred me back to Sac County's kind of language.
That's not a lot.
I know, that's what I'm getting at. So the discussion was, if the legislature put in there that these groups or these individuals could have designees, and their intent was that people that are not mentioned could not have designees. And so that's the question. Do we want to just go forward with that language and those folks can have designees and the folks that aren't mentioned? So that wouldn't impact, elected officials essentially.
Attorney, it seems like it could say that if the intent was that it should only be officers, then that's not what it says, right? It's just specifying. So like, if it's open to interpretation, I think we should interpret it. Process to be functional.
Yeah, I agree with that.
What is the, does the legislative, the way it's written, require bylaws?
No, I think, I don't know. I'd have to look. It's in 1230 PC is the sections that go over the CCP. And, and the CCP was first created with 678 and no one really had a CCP back when 678 was around. But then when Baby 109 came around, then they kind of got together. I think when I looked, and I don't know if I looked at all 58 counties, but I couldn't find any others without bylaws. And generally when it's, a Brown Act meeting, there are bylaws, so they go through these things. And that was kind of the discussion of some of the things with budget and innovation funds and all those things would be helpful if we had bylaws to outline those things. So it wasn't trying to recreate it every year, or if someone new came along and had a different idea or something like that.
And similar to that, Jeff, when you're looking at all 58 counties, the issue with designee, how are other counties doing? Are we on solid ground to do it either way?
Yeah, I mean, there was a mix, and it was weird that, the only one that county council referred me to was Sacramento County, which kind of conflicts with the information that they told me. But I think where they got that information was when you look at their actual roster, it has designees on it of people like a probation designee, and I'm not an elected official, chief of police designee. That was the confusion.
My comments were something to the effect that I don't have an opinion really on how it lands. I don't think that people shouldn't be able to have designate or should. I just want it to be so that our county doesn't do something incorrectly. If there's precedent of other counties doing in their bylaws a designee clause and it seems to work, and they aren't being targeted by the state for doing something inappropriately, then that gives us a little more cover. If we're right now like one of the only counties without bylaws, and we create bylaws and we do something that isn't consistent across the state, that's where I would be concerned. But if I'd leave it more to people who might want to use a designee, but I don't think it's a huge issue, especially for this group, because some of our organizations have people that deal strictly with budget and operations that might be a more appropriate person.
And it's separated out for like voting members versus non-voting members, like the general, the executive board versus non-exec. The only other thing that I was going to add is we meet, 4 or 5 times a year. Is it that difficult to get those 7 individuals in the room, 4 or 5 times a year? And is that really an issue, or is it for other reasons. You know what I mean?
Well, I think it's twofold, and I did a very unscientific survey at Cal State Sheriffs and asked which sheriffs are voting members of their CCPs. I got 0 response. They all said, I don't do that. That's, my staff are well more equipped to handle through the direction. Clearly, they're not doing anything outside of philosophy and direction of their office. So I don't think it's specifically about who has the time for the meetings. Is it beneficial for the conversation? I could have a conversation and not be into the details of what my staff have. That would be more beneficial to have in a conversation than I would be deferring the entire time.
Yeah. And it calls out the sheriff. I mean, the sheriffs can have a designee, so.
Yeah. So
it's probably-
for my, and I look around the history of this and the meetings that we've had and the production that we've had out of our CCP, and I have no problem with anybody wanting to have it designate. I trust the people in the room to way in which their organization sees fit.
The only thing that they did say, county council said that the designee would have to, like, we'd have to set it like once a year, this is the designee, or these are the, and have some sort of limit. So it's not like the entire roster of the department, you know? So that's the only other piece. So how about this? How about the draft that we had been looking at, I'll set it up with designees and then I'll put in there like, I don't know, maybe at one meeting per year, we'll put, that's the time that if you want to switch designees or whatever, and attach that roster, and then we can look at that and either sign off on that or not sign off on that.
Things, but if somebody retires or then
Yeah.
there could be an exception potentially.
Yeah, I think there was in some of them that I read said like, you know, should someone leave, you know, you have so much time to do it. And then, so on that same note, county council also reminded me that since it's a public meeting, and I think we talked about this last time, that folks have to be in person. And if they're not in person, and I can send this out, there's some rules and some exceptions to not being in person, but that requires same sort of notice.
Alert us if all clear. Okay.
Like some people get it.
Yeah,
You don't need to know. Off the gun or off the gun?
it's Crown Point.
Everything's good.
As long as it wasn't your.
It's all good.
Which facility was it? Wait,
And so, where was I going? What was I saying? I got totally lost.
In-person
About,
versus
oh, in person versus virtual. So I'll send that out, which is kind of the like guidelines for when you can attend virtually. But it sounds like we have to redo like the public notice and some other stuff. And like, I didn't read the entire thing yet, but it's also sounded like if someone is attending from a remote spot, then it has to also have access. The public has access to it or something, which if you're sitting at home, I don't know if you really want to have that. But so it sounded like try to be in person, and it's a high bar to attend virtually. So any questions on that?
So Jeff, I have a little bit of information about that because I'm on a state committee where, and what the deal is you have to have a quorum in person.
Yeah.
So and so long as you have a quorum in person, you're good to go. But if you don't have a quorum in person, then there are hurdles you have to pass in order to have your voting members appear virtually.
All right. So let's try to make sure we have a quorum. All right. So the next thing is budget and funding requests. And so we've done this a couple different ways the last few years. And so I sent them out to folks to the exec with a roll up that Angie did. And so I think it was last year we did it to where folks wanted to look at them a little closer. And so we scheduled like another meeting like a week later for people to take a look at them, because in an hour, there's not really time to kind of comb through, you know, and have any questions you want to answer and that sort of thing. So I don't know if we want to do that again. And maybe that's something that we build into kind of the the budget process and the bylaws, if that's something that people want to see. And part of it was, it's just sometimes getting them all together and corralling everyone to get all those documents in. It's just a timing issue.
2 notes on the.
Okay. And so we can briefly look at the roll-up and then have that discussion whether we want to go through each one or if we want to call another meeting and do it that way. And so when you look at the roll-up, is this the one you sent to have that?
So we did receive the behavioral health jail-based therapist request, and it did remain the same. So if you're looking at the electronic version that has a note that says request not received, you can disregard. And then the other piece was the sheriff's.
Okay, we can get that in a second. So all of them go up, like if you compare them to last year, all of them go up slightly. I think treatment went up significantly for some reasons we can go over. I did talk to the court last week because we do put in for the pretrial for funds to help out with pretrial. Although I did tell the court, we put that in from probation. I did tell them that is something that the court could put in. I don't think Tanya was at that meeting. It was Layla, but we're requesting those funds, but it is a court contract and a court function. But for reasons I want to get into, we put it in for them, but letting them know that it is kind of a court request and not a probation request. Which they understood, although I don't think they're going to move forward and be requesting it in the future. But anyways, the treatment piece, you want Steve to go through it, or you want to go through it?
Well, I would just say the significant change in the treatment piece is ultimately just the move of the probation-based therapist from behavioral health's budget to we are now contracting out with Doc O'Shea. And so that's part of the treatment budget that falls under probation versus the HHSA portion. So that's why there's a change there.
And just why that happened, for your knowledge, is she did work at behavioral health and now she's gone off on her own. So it's a different contract. As well as some of the costs, this year, some of the costs for, I don't know if it's reflected in this, but some of the costs for transitional housing has gone up, or the overall amount has gone up relative to the use.
Yeah, we are, so far this year, halfway through, we are almost to the limit of what the contract was. I think the contract was for $60,000. We're already at 54, I think. Is that accurate?
Yeah.
I think there's potentially some reasons. We've had this contract as high as $100,000. This is for common purpose. It's going to take me a while to continue to say that. And we were underspending it heavily. So a few years back, we decided to actually get it closer to what we were spending. I think there were some reasons for that. Some of it was there was some more money in behavioral health that I think was that it opened up for transitional or recovery residences. And I just think generally Nevada County has been more like the door-to-door concept of people getting out of jail after the disposition of their court case. There's a lot more of those going on. We have more people that are in jail assessing needs. So I think there's just more individuals that are going directly into treatment, residential treatment, and then typically by some of the treatment plans that I've seen, that usually is a follow-up of some period of time of recovery residents. I don't know this to be completely accurate, but I have to assume that some of that is people staying in longer because it's tough to with housing and low-cost housing. So it's more difficult to get out. This increase is not with our Granite Wellness contract. We've seen a reduction in that. I don't know exactly all the reasons for that, but this is with common purpose. I know the drug court is using common purpose recovery residences quite a bit more than traditionally. So yeah, it's quite a bit up with the concern, but I think this is somewhat right sizing to where had it passed of the increase.
And so the other things that are on here. Training, which I don't think we even used last year, or we used a very small amount, if any. And the other pieces that we haven't done. So I know a few years ago, we set up the innovation account, which was required in statute. The other piece is there's a 5% that you're supposed to set aside for evaluation or supposed to spend on evaluation. I don't know if you necessarily need to set it aside. And so throughout the years, we've paid for analysts and stuff like that. And so I don't think we have the last 2 years. And so we have to carve out that 5% for some sort of a evaluation. So one of my thoughts was, we have the money in the training, the pot of money in the training, 5% for evaluation. And in our strategic plan, when we talked about being data driven and those sorts of things, that we have the potential, and as well as Grass Valley PD had talked about, police departments moving towards maybe an evidence-based policing project or something like that. Using those training funds and maybe that 5% for evaluation, and looking at some of these things that we just don't always seem to have the time to accomplish relative to some of the outcome measures and some of those things that we're looking at, and hiring out for someone to do those things, whether that's, the connection that we made at Chico State, at the university level, or some sort of other independent evaluator to look at some of this stuff. And so with that, I know it's later in the agenda, but we had the CCP plan presentation report out. So that got postponed. It was supposed to be the board meeting. I can't remember exactly, a couple of weeks ago.
Yeah.
And so it got pushed to the 11th. And traditionally what we've done is just gone through our plan that we've updated since 2011. And yeah, there has been a lot of changes in the plan. And part of it was there's new supervisors to kind of go through how we got to where we've gotten. But looking at some other counties, besides just going over the plan, they do kind of an annual report that has, these are the projects that we're funding, this is the percentage of the funding, and these are some, metrics that go along with it, like how many people were served, those people that went through specific programs that were supposed to reduce recidivism, did it, whether it's, if it's a mental health program, did it meet the metrics that mental health program has, or that supervision program, or whatever it is. And they kind of go through this process and I printed it out so I can share it with folks. And I think we've looked at it once before. But it seems like it's more informative as to the effectiveness of what we're doing versus what we're doing. And it seems like that's more in line with the way to move with the strategic plan that we did and the ideas that we had relative to like, what are the next steps for the CCP, and trying to make sure that, those funding decisions are based on things that work, things that are serving people, like through, cost benefit analysis and those sorts of things. As we take kind of that next evolution into what the CCP can be and what it can provide, I think, to the justice community. But I think that's a good spot, at least from my perspective, where to spend that, evaluation money that we need to carve out and some of those training dollars. Does anyone have any questions, comments, concerns?
That's under the big old for mental health services or connections to other mental health services. So this like generally mental health coordination with mental health, not really about those cause of counts.
So Phoebe and I talked, this was a while back that Phoebe and I talked. I think part of the problem was at the time was staffing, relatively to staffing the position. And I think one of the other discussions was, since Dr. O'Shea had worked for the county for so long, she had those connections of knowing when to move people over to behavioral health or keep them there, as well as some of the flexibility that it allowed using Dr. O'Shea with some of our clients.
Yeah, that was exactly, I mean, keeping somewhat similar to that concept if a referral was made, that if they kind of after assessing and it was like, this should be a behavioral health client, with Dr. O'Shea, and there was a couple other individuals that was in that role after she left, but this is the most similar kind of system that we could actually get with a private contractor that was familiar with how the probation department operates and referrals and also behavioral health. So I think we've got really lucky to kind of get it. We carved out a day. I don't think she does. We don't have a particular day where you're refer over, but we got to at least carve out a day time where we could send individuals over because we had that. There was quite a while where we didn't have anybody in this role, and I think it fills a really needed gap in the system. So I feel like we're actually
Somebody was eligible for behavioral health services, she would connect them, they would get services through there, not paid from CCP, but building is Medi-Cal like we do with.
absolutely, yeah.
I don't know, Phoebe, if you had anything to add to that or.
I can't hear Ryan, unfortunately, so I'm hearing your guys' side of it, but I'm not hearing what he's saying other than that it's Ryan talking. So I'm not sure what the question was exactly. Do you mind repeating it?
Just in terms of, so whether we're leveraging Medi-Cal billing and what I heard from Steve was that Dr. O'Shea would refer over to county behavioral health so that we are leveraging that versus paying everything out of limited CCP funds.
Yeah, I haven't checked in detail in a while on how many people are getting referred over, but I know back when behavioral health was staffing the position, we were not doing a ton of Medi-Cal billing. So the majority of folks don't meet our threshold. And so don't end up on our side of the house. And so I assume that, yeah, Dr. O'Shea's super knowledgeable about who belongs on the behavioral health side and referring over, I hope pretty quickly and I hope pretty seamlessly, but can circle back and confirm that.
All right, so I guess going back, because I mentioned a lot of different things. The first question was, do we want to vote on the budget today, or do people want to go back and take a look at some of the things? And so part of that is we did a few years ago make a kind of format, and some folks, the information varies from request to request and the format slightly varies. But do people want to take a look at that first, or are people ready to make a vote today or take a vote today, I guess?
On the behavioral jail-based therapist is in red on your document. Is that something, does it call?
That was the one that, sorry, I'd mentioned at the beginning. We got that one a little bit later than the other, so we had that in there as a placeholder, but it did stay the same amount. So we got that. It just didn't get updated.
So it's incorporated in
Yeah.
the.
Mhm.
Sorry for the lateness. That's me.
See, I didn't get an opportunity to read any of it. Get in.
Okay.
But I don't, I staffed it.
I was able to review it. I mean, it didn't look, other than what you've already talked about, substantially different. The sheriff's office does want to make an adjustment to our ask so that it's based on 50% of the total estimated revenue, not just the base realignment revenue. So that updated amount would be $1,857,282.80, or just be rounded at $2. So that's $1,857,282. It's an increase of 76,987, and it's just it's basically 50% of the total estimated revenue in probation spreadsheet of 7 million. My only other comment related to I'm not sure I was totally following what you were saying, Jeff, about the training and the evaluation, but maybe that line item could be made more broad. It's like a contingency for training and evaluation or whatnot, so you have more leeway as the year goes along to how you want to utilize that $50,000.
Well, and at this point, we don't have the 5% really called out in here at all, because that would be more like, depending on where revenue actually ends, like $170,000.
That's the piece that's actually in statute that says you have to spend 5% on evaluation.
If we were to add 5% additional expenditures that aren't in here, to your point, that's another quick math, 70,000, right?
Well, if we're lumping it with the 50,000 of training, then
Offsetting it,
or if it's an addition, I don't know what your thought process on that was. It would either be in the neighborhood of 170 total, including the training, or if you add another 170,000 to the 50,000 that's already there.
I mean, my comment either way, I mean, if you add it to the 50,000, it definitely has a larger impact on the bottom line, but then here in the sheriff's office, 50% number, there's another 70, so there's another 140 to 190,000. We're already hitting the drawdown at 180. Now you're looking at 280, 300,000. So you're approaching 7% of our contingency. I just think at some point we need to start evaluating our overall expenditures on the year. For 1 year or 2 years, that's probably fine. Although I don't know what the industry standards is. Seems like we have a pretty high contingency value here. I mean, you're talking 100%, over 100% funded. Seems high to me, just guessing. I don't know what other CCPs are doing. So maybe it's fine to overspend for a while, but.
Yeah, and that's the thing. I mean, I think this would probably be an Aaron question, but I think like budgeting is like 15%-ish, 15-20%, which is always kind of seems low to me. But
it depends on what your intention is with that contingency. Sometimes you want to have a full year of ramp down, which means 100% would be appropriate, but really up to the board, how, if legislation were to pass this year that this money goes away, you don't want it to abruptly stop. You want to be able to limp it along and have a slow rollout. So.
And that's the other piece is from what I've heard, and we've heard this for a while now, is that there's also the thought of, depending on the state's budget, like if you have too much in a contingency fund or unspent funds, then they look at, oh well, do they really need this because there's so many unspent funds there, or we can figure out a way to scoop that back up and spread it out to somewhere else. So it's kind of it's anyone's best guess at how that works. I mean, this is a program that's saving the state money, so.
If you need a minimum 3 months worth of expense is your minimum.
Good for.
Yeah. So, yeah, and I see what you're saying. And so that's another piece, and that I don't know if I touched on it yet or not, is when, if we're looking at this evaluation piece, do we want to look at, and we've discussed other counties multiple times of, do we want to look at how are other counties spending their money? How do they present it? Like, is there a percentage breakdown? I mean, I know Placer County did their plan in 2011. They haven't updated it since. They came up with percentages and they haven't changed a single thing.
Maybe that's an exercise for when we are trying to approve a budget.
Yeah, well, that's what I'm saying. Like, moving forward, is that what we want to do, to look at like, where are these expenditures and those sorts of things? Like, how much do people spend on treatment? How much do people spend on probation? How much do people spend on incarceration, or whatever it is relative to that total amount? Because I know when I looked up in this document from Yolo County, it does have like the percentages. Like, I think it's sheriff and probation are at like 27.5, and like treatments at like 25%. Innovation is at like 9%. So they have like, the breakdown's a little bit different than ours is. I'm not saying that's the correct breakdown, but just to look at kind of what the going kind of trend is across the board. So, but as far as the budget today, are people wanting to move forward? The only addition, which I included in the email, is Dan Foss, not Chief Foss, had a ask relative to a nonprofit. And I did talk to Dan about how it might be during the innovation kind of process, because that's how we've worked with nonprofits recently in the past, is relative to putting out the ask to all nonprofits. We have this innovation It might not be during the normal budget, but I said that I would put it out there for folks to discuss whether we wanted to do it that way or not. So that's the only different piece. And it's not included, I don't think, in this roll up. So
You just show the current innovative fund transfers out,
Correct.
correct.
which
Anticipated based on the growth.
anticipate. Okay.
Yeah.
The detail was in your attachments. It's an ask for.
Yeah, the attachment was included.
When, do you guys recall what meeting we did that last year? Was it the March meeting?
Yeah,
Well, we put it out
in February,
in
right?
February and it was supposed to be feedback, but it's like the 10th or 11th of March. So I mean, we got, and that was with the anticipation, with the hope that we would get a contract up and running July 1st. So that was why we were trying to.
So how much would it disrupt things to hear what Dan has to say and then just review it one last time and vote on it at a different date?
Yeah, that's fine. The only concern I had was like the fairness issue of like putting it out to all nonprofits to make sure that, you know, if we were going to decide to, because we kind of put it out there as a competitive grant.
Almost like an RFP, I mean, right, we put it
Yeah.
out and said, hey, this is,
An RFP light, yeah. And so that was my only thing was, if we're gonna put it out there, do we want to put it out there to all nonprofits to make sure everyone has kind of an equal chance to access the funds?
Also the maximum grant that we had the last time was 15,000 per
Yeah,
organization. So
15,000 per
And there was
two.
something else, because I think in there it said 3, like you had to be a nonprofit
Yeah, it's a
person.
nonprofit active for 3 years. Yeah, the previous grant,
I'm not saying we can't change some of those parameters, because those were all created by folks here in the room, so. So two questions. Do we want to vote on the budget? And do we want to vote on the budget with the request in there now or the requests? Don't all speak up at once.
Michelle, what do you, I don't know, refer to you on this? Have you had a chance to review all the documents and?
Some of the documents, but not all of them. It would be nice to finalize these numbers sooner rather than later, since we are all working on budgets currently. So, I mean, I could go either way.
And
How
last time
soon would we meet again on the budget?
last time we deferred it by a week. I mean,
Hmm.
and it was like a 20-minute meeting after people just had a few comments that they wanted to make.
Right, that's not too bad.
I just had a thought, because I agree too, I'd like to see the numbers as, you know, the modified proposal here, maybe the innovation dollars put in there, so we kind of have a comprehensive spreadsheet on that, but then could we potentially look to, at the same time, put out the nonprofit solicitation piece and include that number on the budget side? We don't know how much we would award or not. And then have a time frame on that, so we could approve the budget, including the nonprofit innovation funds piece, and then we'll come back to hear those presentations and have all that done in short-ish order, so that people get their budgets done.
Yeah.
I mean, that works for me.
What's your schedule?
The innovation, yeah. The innovation fund piece, just as a reminder, is its own little standalone little fund. So the numbers that you're seeing on the spreadsheet don't include innovation fund dollars. So if, you know, money gets taken out for innovation fund projects, it's not going to impact our bottom line on this side. If that makes
And it
sense.
also draws from all realignment funds, right?
It does. It draws from DA, PD sub-accounts, trial court security sub-account, our juvenile justice sub-account, and the CCP sub-account, or the, if you want to. Yeah, I know, it's a lot, but
Which I think CCP is biggest, right?
CCP and the juvenile justice ones are the two biggest, yeah.
The innovation funds are for time to load projects, so it's 50,000 per. CCP.
Yeah, I mean, that's how we did it last time, so.
So the idea would be fun.
Right. Yeah.
Seems like more appropriate. Curiosity perspective of to hear more about it.
Yeah. Yeah, I mean, you guys can go ahead.
You may just do the presentation, we'll go from there. Is that what you're gonna do?
Yeah.
Okay, so, my name is Dan Foss. And this is Liz. I'm gonna hand these out while I talk, and then Liz jump in. I didn't print enough, so that's makes me have to show you. But we're looking at starting a nonprofit. Well, we have started. We're 501(c)(3) now. We do have a board for community members or with our community here. So what it is PAWS, protecting animals while supporting sobriety. So here was a gap in services that we kind of located. This is actually Liz's idea. Liz came into my office. She was trying to figure out how to help some of our communities most needed or most needy and preventing recidivism as much as possible. And there was one huge gap in services that I wasn't even aware of. So basically what it is, doesn't affect everybody, but it does affect a lot. If you have an animal, so say you're suffering from addiction or you're homeless or whatever it may be, and you have an animal or two animals or whatever it may be, and you want to seek treatment, in our county, what are your options? You don't have family that'll take your pet, it goes to the pound. So most people are not gonna do that. If that last thing you have is your animal, your pet, and in order to seek treatment, you have to give it up. Just most people are not going to do that. They're going to avoid that. So we identified this. We did partner with one of our board members is admin with Sammy's and Friends, because that was the first call I made was, is this true? Is this legit? Like, do people have them? She said, yeah, it's a huge problem. And we run into all the time. So we started PAWS. Our board now consists of myself, Liz is the president. It's her idea. We have a longtime vet owner here in Nevada City. I'm in with Sammy's and Friends. And the idea is this: if you are seeking treatment, if you're trying to get into a rehab facility, if you're about to be homeless and you need assistance, whatever it may be, we will take your animal. We will provide a foster family for up to 18, 24 months. And we will provide bi-weekly to monthly updates of your animal, how it's doing, so that while you're getting better, while you're doing what you need to do to better yourself, your pet is taken care of. It is, in my mind, anticipated to be somewhat of a small program, but I've done this before where these small programs can sometimes blow up into rather big programs. But we're starting off small. So our request right now is $20,000 with seed funds of $5,000. Perfect thing.
Okay.
And but 20,000 total. I'm the treasurer on this, and I have done a couple nonprofits in the past, and I have relied on CCP funds for those to some degree. But I want Liz to jump in and kind of explain it more. Let's explain to you. Go for it, Liz.
You did explain a lot of it, but no, you're good. I appreciate it. So I'm here today for that represent PAWS. Stands for Protecting Animals While Supporting Sobriety. It's an innovative program that addresses a critical barrier to addiction treatment in our community. Many of our neighbors facing addiction are forced to make an impossible choice: seek life-saving treatment or keep their beloved pets. For many, these pets are the only family and source of emotional support that they have. Research shows that 30% of individuals delay treatment due to pet care concerns. But when the clients know that their pets are safe, treatment completion rates increase by 38%. PAWS offers a comprehensive solution by providing temporary foster care, veterinary services, and regular updates to owners while they focus on their recovery. This program isn't just compassionate, it's cost effective. While our community spends approximately $12,119 per year per untreated individual struggling with addiction, every dollar invested in addiction treatment yields $18 in reduced costs to our community. Additionally, our foster-based approach costs $403 less per animal per month compared to traditional shelter. We're seeking initial funding of $20,000 to launch this program. Similar programs across the country have already helped thousands of pets while supporting their owners through recovery. With your support, PAWS can remove barriers to treatment, save both human and animal lives, and build stronger, more compassionate community.
So we're open to questions on it. On your little handout here, I know you have to share some of my apologies, but it does show a lot of stats that we were able to pull up that, as is touched on, there is a very direct correlation between people having their pets being taken care of and them doing better in their struggle and the process of getting back on their feet. So, in my view, I mean, I think it's one of those things that you're always doing cost versus reward. I think this has potential for huge support for our community, and it is definitely a lack of services. I could give you, without taking up too much time, I could, if you guys are interested, give you a real brief synopsis of what our timeline is, what we're looking at doing, and how we're looking at going out to the community. We haven't really announced ourselves yet. We're hoping to do that next month and kind of dive into all the city councils and county supervisors and everything, and bring the program forward and let everybody know what it is. And we're hoping to be able to say we have supportive CCP behind it when we do that announcement.
Are there
That's right.
providers that allow pets right now?
Not to my knowledge. Yeah. I mean, residential don't have.
But homeless shelter, yeah,
Hospitality house allows certain.
certain pets.
I have a question. Can I ask a question?
Yeah.
Do you anticipate this being for non-incarcerated individuals only, or would this potentially be a foster environment for someone who's had a pet, is incarcerated for short or longer duration of time under like a CCP or AB 109 qualifying person, or would it be more for out of custody only treatment?
So I think, in my view, it would be for everybody. We're doing our bylaws now on how we would do it. They would have to apply for the program. And then there's multiple pages that we are working on now of the process and what they're going to do to better themselves to get the animal back and what their plan is. So even if it was incarceration, especially for a short term, especially if they're going to a care court or something like that, I think this would be a perfect, and the care court's incarceration, but perfect program for them to jump into where we can have their pet's going to be safe, so that we do know when they're trying to get back out, when they're trying to get back into society, that's one less thing that they have to worry about.
I know that we have issues running the shelter where people are incarcerated for indeterminate amounts of times, whether, at the point of arrest, we don't know how long. And so if there's an option because sometimes the animals end up going out for adoption because it surpasses the 5 days and there's not a financial ability to pay. So.
And one of our board members, as I mentioned, is the Sammys, and they struggle with that all the time. And she was explaining to that in one of our last board meetings. So yes, I anticipate we would try very hard to take those pets. And it is a process where they would have to apply. We would try to take those pets, put them into foster care, so that when they do get out, they're able to reclaim their animals.
We're talking
Okay.
just dogs.
So go ahead. So go ahead.
I was just wondering, what kinds of pets? Is it?
So right now, dogs and cats, but we are interested in expanding to all.
Overseeing the shelter.
I think I'd be interested in knowing what the eligibility criteria are for this application that you want people to have, as well as the eligibility criteria to be a foster for these people's animals. I would need that sort of information before I'm prepared to even look at it. But I also think that this is an innovation fund project. Not appropriate for the budgeting time.
So I can answer the question. The foster part, we have not developed the criteria or the contract with the foster families, other than to say that we want them to be committed to 18 to 24 months. The criteria, your other part, your first part was what was their application process. We have been working on that quite a bit. They would have to sign the pet over to us. So essentially, we own the animal during that time with a contract that they're going to get the animal back if they've met certain criteria at the end of the contract period. The reason for that is if it did need medical treatment, if it did, which we would be providing, if it did need medical treatment, if it did need to move homes, we have to have ownership of the animal at that time. Go ahead, Sam.
So I think the concept is cool. Like I like that idea. It's the problem is we have a shelter that's already overwhelmed with animals nonstop all the time. It's what they say on a regular basis. We have unknown number of animals in foster care already. And on top of that, the CCP won't control things like what's the medical cost and things like that. There's oftentimes I have questions personally about the choice of what kind of dollars are used to provide services for an animal within the shelter. Whereas as a private dog owner, I might not be willing to pay $5,000 for this procedure. But as a nonprofit shelter where the money's just coming in, you're like, oh yeah, no, I'll pay for that. Anyway, so lots of things on that end. But if there's no foster space, but then the person passes this eligibility, and then where does it go? Are we offsetting animals that we're required as the county to oversee and run a shelter? Do we have to offset that because of this grant program? Is Sammy's Friend going to be more inclined to take that animal because this other one isn't? So I have a lot of concerns just on the shelter operation side, not on the concept. I think the concept is pretty cool, but I think some of those things need to be worked out because they are constantly at a state of, we can't take any more animals. And now they're telling you that they can take more animals in a foster setting. We can't even drop off animals that were required by law to seize without them telling us that they don't have space. And so there's some concerns there. Now, if it was like a nonprofit or somebody else that was, hey, they're fostering the animals, this is the price, this is what we take.
This is a nonprofit. So this is totally separate.
I understand that they're running the county shelter where the laws and the requirements of what they take are different and they don't control that. Because if we get a dog, we are required to take it to the county shelter. They don't get to say no. And so that's why they're overwhelmed. Nonprofit that is not running the county shelter could say yay, nay on whatever animal they wanted. That's the difference though.
Yeah, but I think the individual still have agency over their animal prior to going into treatment, right? So they would make those decisions prior to any sort of statutory laws being triggered by the shelter having to take an animal.
We're separate from the shelter completely. We would not be working with the shelter, we'd be working directly with clients that are.
I thought you were asking about like, there's only so many fosters, and if people are already fostering with Sammy's Friends, like, are there gonna be,
I can see
are there
that.
gonna be more fosters?
There's just this, if you're gonna put $20,000 to a project though, we need to know that it can come to fruition, I guess is my end, because we don't want to set $20,000 for something and it's not even accomplishable. I guess that's my concern in the big scheme of things is that, yeah, they apply, they get the application, it gets approved, and then there's no way to do that because much like Alex is saying, when we have an AB 109 person, if they're in custody for 2-3 years, that is not healthy for a dog to be elsewhere for that length of time. And so there's a lot of that criteria, which I realize isn't maybe worked out yet, but that makes a difference on the health of an animal. And then if they can't find a foster, does it stay in the shelter or are they just gonna say, hey, we'll take it? And, I think there's just pieces that for the health of the animal as well, needs to be considered, not just for.
Yeah, I mean, we would.
Animal control wouldn't mind like working together and sorting through some of those concerns, so.
We wouldn't be interested in doing 2, 3, or 18 to 24 months is at most what we're looking at doing for this. We would be doing more outreach to direct to community. I do understand your concern where there's only so many fosters, or you're gonna tap the well, right? We're looking at being small based and we wouldn't use the same fosters that are coming from the shelter. We'd locate our own foster families that are wanting to foster just for this program. The $20,000, I do understand your concerns there too. However, my approach for this one is this is a startup. I'm looking for startup funds as opposed to, hey, we've been running 3 years funds and it's encumbered funds. So we're not even going to say we'd spend it. So say we do start it up and I come back and do a 6-month or annual update of where we're at. If it's a failed thing, we fail to get off the ground, your $20,000 goes right back to you. This is not, I'm looking for 5,000 seed funds, but the other is, we're not just getting a check for 20,000. It would be, reimbursement on our expenditures as we're doing the building of the program. So I'm looking for startup funds, which is a little bit different than typically for nonprofits when you're looking for funds for the running, because some of those questions, again, I think it's a relatively small amount, but those are the questions I need the funding to get the attorney to make sure all my bylaws and everything else are where they're supposed to be.
The non-incarcerated, I think, is an easier, like what Alex is saying, we don't ever know when somebody's going to get out. So we could say, hey, they're going to be in for 12 months, 18 months. The court's the only one that's going to tell us that. And we may not know that for 2 to 3 years because they sit in custody pre-trial for quite some time. So your people that are out and that are looking to go to program, I love that idea. People that are incarcerated, I see a lot of struggles in that realm, unless we know when they're getting out. So as you consider criteria, say that.
Yeah, and as a small nonprofit initially, especially for the first couple of years, every single case will be evaluating. So every case, so say I do have somebody that's in custody, I'm gonna call Jesse or I'm gonna call probation, say, hey, when do we anticipate this person's gonna be out? And it's not set in stone, but that gives us a pretty good idea of, hey, this might be a good candidate for the program.
Because just to question for anybody that knows, is Pets in Need still in operation? Because they do the same thing. It's Patty Dolly.
They have their thrift store still, but I don't know if they're, we can find out.
I haven't heard of that.
No, they don't, they do not, they sort of do it, but not significantly anymore. We've had them foster a couple of our clients' pets, but not like they used to. And it's very, very individually driven. And I'm so sorry, everyone, I have to jump off and go to a medical appointment.
Hi, Carrie.
Hi, Carrie.
So the only question I have, and I think I told you this, I'm not a pet person, so probably not the best person to ask about this, but just from my own experience with some of our clients, sometimes they, like, even if you have a place, it's still not with them. You know what I mean? So like, so I don't know if you've talked to folks, like, because a lot of times, and we try to do this sometimes we try to do as much as possible in probation of like, we come up with these ideas, but we've never asked the clients, the folks that are going to be using this service. And then we miss something because we're thinking it from our perspective and not from theirs. Is there still a barrier, like for folks that want to go into treatment or are willing to go into treatment or need to go into wherever they need to go, that yes, they would rather it not be in the pound, but they still want to be with that animal. So they still don't want to go.
I mean, I think that would be ideally for sure. That's gonna be a lot more than $20,000, you know?
No, I'm just saying, like, are they going to utilize the service because they don't want,
Yes,
like,
I think that,
Separate the animal
Yeah.
together, yeah.
So this idea came from directly speaking with unhoused individuals in the community who expressed this as a concern and something that prevented them from into rehab. And our priority is going to be unhoused community first. Everything else, you know, when we get there. But yeah, it is definitely something that's keeping people out of recovery programs. And they would like to utilize their non-this.
Like a public health mantra is making the healthy choice the easy choice, and anything we can do that can help people choose treatment, even if it's incremental and doesn't solve every problem, is helpful. I do think it's more appropriate for the innovation process, and a lot of these questions are questions to anticipate and resolve in advance of that. And similar to that, making the healthy choice the easy choice, if our process for innovation is a barrier to innovative ideas that don't have enough time under their belt to move forward, I think we should look at those parameters, but I would look forward to this coming back for innovation if that's us.
I agree. Innovation.
all right. So we got one of the two questions answered. So innovation. This. And then the other one was, we had talked about budget, and it sounded like, at least from what I heard, that folks were open to the idea of taking a little more time to read through and wanted to see what that roll up looked like with some of those changes. And come back potentially next week for a short meeting to just take the vote. Is that what? Am I picking up what you guys are laying down?
I think that one. I think the issue though. Yeah, is everybody gonna be able to show up next week?
You're gonna have a quorum.
Yeah, well, you have a quorum with enough voters.
We could look at, we could look at that right this second.
Sorry.
I mean, are people available to put it exactly 1 week out? Or are people available anytime on Thursday? At least 4 of us. 11 work. Thursday at 11 works for you. It could work for me.
Yeah, we already have a Sierra Nevada Royal Hospital behavioral health meeting. That's at 3:30, so.
Can you guys just do the teams?
Yeah, we can't vote, but
Especially for a budget enactment.
11 next week.
We don't have a quorum right now, so it might be about.
No, we do.
No, we have a quorum right here.
The proposals are mostly same proposals for previous years, but
It's like half an hour. You do like 11 to.
But it didn't sound like everyone is. So. You're not available?
How many do we need for a quorum?
Four.
Bylaws.
I got four right here.
I got it, Jesse. That's good.
2, 3.
Yeah.
Who's Jesse's?
Yeah. So we have a quorum.
We do next Thursday at 11.
Right.
Thursday, 6 or 11.
Next Thursday at 11. Right here, same place, same time. All right. We'll do that.
What day and time was it?
Thursday at 11.
6th.
6th. February 6th.
Half hour.
Yeah. Like I said, the plan is going to the board the 11th. And so folks are welcome to attend that if they want. It's just a fairly basic overview of what the CCP is and some of the things that we're doing. The last thing was data group. And I think we kind of talked about that in the evaluation piece. And so I know that Brendan has been working on some stuff. We don't really have time today. I know we have one more thing besides that. But we can regroup with that. That subgroup is still, there's Brendan over here. That subgroup is still working on some things. And I mean, we can report out on some of those things via email. Don't have to do it right this second. The last thing that I have is we do need to make a change, as Steve kind of alluded to. We've burnt through all the common goals recovery housing funds. So we need to switch some things around. Angie made a nice email for me here, but since she's sitting next to me, I'll let her explain it so I don't mess it up. So we can get through this real quick.
Sure. So what we're looking at is ultimately, because we still have that money in the CCP budget for the Doc O'Shea contract, and then there's some additional dollars for common purpose that's not being utilized. There wouldn't require a budget amendment for us to be able to go back to the board and do a contract amendment with common purpose to increase their contract to what we anticipate. What we, on the high end, anticipate needing, where we would move it to 140,000.
So we're moving some money that we had left over from the psychologist over to common goals, if that's okay with everybody.
Second.
All those in favor, say aye. Any opposed? Any abstain? Hearing none. All right, any other public comment? Oh, yeah, you're public.
After the designee discussion, is that the last step of like bylaws being able to be adopted? Was that the last final thing?
I believe so. I mean, I'll send that out with those changes and have people look at it. I mean, I'm assuming that there has to be some sort of sign off on it or vote on it.
Yeah, so considering that's, and I mean, everything else, I think is everybody's been seeing and there's potentially next week adopting of those bylaws.
Yeah, I mean, I'll try to send those out tomorrow, so. All right. Can I get a motion to close the meeting, Jesse?
Motion to close the meeting.
Second?
Yeah.
All right, all those in favor? Aye, all right. Thank you.
Thanks, Jeff.
I feel like since we're going to meet so often, like.
All right.
Yeah.
Friday.